This presentation was delivered to Enloe High School's HOSA chapter on February 1st, 2021.
Up to 85% of our health status is dependent on social determinants.
More than 11 million children in the United States live in food-insecure homes, leading to higher rates of anemia, anxiety, and more.
African Americans are 60% more likely to have a stroke than white adults are.
Poverty and low-income status are associated with the 14 leading causes of death.
Hi, this is Dr. Stacy, your primary care provider from Women's Specialty Care Center. I'm calling to talk to you about test results from your appointment last week. Everything came back perfect. Although it is a little early and not necessary, we do recommend that you undergo some screenings for breast cancer. This is purely for prevention and early detection.
Hi, I'm a receptionist at the Wake County Public Health and Medical Services Center. I'm calling to talk to you about your test results from your last appointment. Because this is the first time you've come in for a checkup in 2 years, the results indicate a high risk for cancer.
Would these screenings be covered by my insurance?
Yes, you wouldn't need to worry about a thing.
There's screenings and treatments for those, right?
Yes, but they're really costly. Unfortunately, you don't have health insurance, so all those expenses would come out of your pocket.
Thank goodness. Can we talk about this more in person?
Of course, would you like to come in for an appointment sometime this week?
I can't afford that cost while paying for my rent and supporting my family. Are there any other ways this could be treated? Could I maybe come in to talk about it at an appointment?
Honestly, Miss P, there's not much we can do because of the expenses of any type of treatment. I'm really sorry.
I can drop by around 3 tomorrow if that sounds good.
Perfect, I'll see you then.
Is there anything else I can do for you today?
No, thanks.
Mom, I'm back from school. Mom, guess what? I aced my math test.
Excellent job, honey. I'm so proud of you.
Mom, I'm struggling in math. I need help.
I'm sorry, I don't have time. You're just going to need to work harder.
Thank you, Mommy. I'm hungry. Do we have any snacks to eat?
Of course. I made your favorite. It's on the table. Go reward yourself.
Can I have a snack before dinner? I'm really hungry.
We're tight on money at the moment. You're going to need to wait until dinner. I'm so sorry, sweetie.
The social determinants of health can be split into 5 groups. The first one is economic stability. Factors such as stable housing, poverty, and food security fall under this category. The wealthier a person is, the easier it is for them to access resources such as nutritious food and healthcare. Adults that live in poverty are more than 5 times as likely to report poor health as opposed to adults with incomes at least 4 times higher. Furthermore, the unemployed tend to have higher levels of impaired mental health and chronic diseases.
The second is education. According to the National Institute for Literacy, 43% of adults with low literacy skills live in poverty. As seen in our video, children from low-income families are more likely to struggle in school and are less likely to graduate high school or pursue higher education. This means that it's harder for them to get a safe, high-paying job, and they fall back into the economic instability cycle.
The third is social and community context. Minority groups, people with disabilities, and sexual minorities are statistically proven to experience higher levels of discrimination within the medical field and have an increased risk of poorer health outcomes as opposed to their white or heterosexual counterparts. Additionally, an individual's relationship with others can have an impact on health. Kids who face bullying, for example, have an increased risk for suicide, depression, and substance abuse.
The fourth is health and healthcare. In 2019, 28.9 million American non-elderly adults were uninsured. In our video, the woman with health insurance had access to several medical benefits, while the uninsured woman did not even have a primary care provider and was unable to afford the cancer treatment.
The fifth is neighborhood and environment. In the United States, individuals that live in neighborhoods prone to poor construction or violence are exposed to many health and safety hazards and are less likely to have safe water or clean air. For example, the individuals in Flint, Michigan that are experiencing health effects from the unclean water live in low-income neighborhoods. Location can also have an impact on one's health. Some people may live too far away or don't have reliable transportation to access required health services.
So, how can we address the social determinants of health which plague our communities? As this arrangement shows, there are several little solutions which work in tandem to dismantle health barriers. The first is to require healthcare providers to ask their patients routine social risk screening questions. These pertain to a patient's ability to access nutritious food, stable housing, affordable transportation, and more. According to a health and community survey, 40% of patients report that their primary care doctor is unaware of their struggles, potentially resulting in inappropriate care plans. Social risk screening questions will prevent this and also allow doctors to refer their patients to appropriate community services.
As future healthcare professionals, HOSA members understand the importance of cultivating a culturally safe environment for diverse populations. If you know multiple languages, consider volunteering at clinics. Community members can also act as social support navigators for patients at clinics by helping them fill out paperwork or communicate with personnel. HOSA chapters can also push towards implementing cultural competency training for all healthcare providers. This will help reduce barriers for patients that may not be able to communicate social risk factors or healthcare problems.
Early childhood development is the biggest factor in determining a child's future well-being, and this starts in schools. HOSA chapters can help by tutoring others, helping them navigate the college application process, and also introducing bullying and violence prevention programs to create a supportive environment. We should also connect with local hospitals to advocate for more nurses and mental health professionals in our school. Often, a school official may be the only healthcare provider that a struggling family's child may see. Student organizations should also establish food gardens to provide children and their families with healthy food. Let kids know that access to basic healthcare needs is a right, not a privilege.
Another part of the solution is establishing various drives, such as collecting food to reduce food insecurity, clothes to meet basic human needs, school supplies and books to increase access to education, and menstrual hygiene products to reduce societal barriers for females. HOSA can also connect underserved populations to free or low-cost clinics in the community. By creating resource guides with information about the various clinics and then distributing them to homeless shelters and food pantries, more people can receive healthcare at an affordable level.
As you have learned, the key to addressing social determinants of health does not lie in one avenue, but it does take the voice and action of just one person to make a difference. Push your government officials to invest more in early educational opportunities, affordable housing, low-cost transportation, and more. There are several barriers which disproportionately affect certain groups of individuals from attaining standard health levels, but you can help achieve this.